Welcome, everyone. I am Anant Balasubramanian. I lead the industry verticals category management for AWS Marketplace. I have here with me today one of our customers, Jacob Parcel, Chief Technology Officer of Redsson, a healthcare technology company, to discuss how you can simplify the complex requirements of complying with healthcare regulations by leveraging third-party solutions from the AWS Marketplace. We have structured today's session to cover three main topics. First, we will discuss why and how healthcare compliance is both needed and challenging. Next, we will talk about how you can simplify your compliance needs by leveraging third-party solutions from the AWS Marketplace. And finally, as proof point, Jacob from Redsson will talk to you about why and how they used a third-party solution to solve for their compliance instead of building out a homegrown solution. Now let's jump into the challenges with healthcare compliance. We all know that regulatory compliance is a must in healthcare industry. With healthcare IT growing, there is a rise in need for a compliant infrastructure to process and store electronic protected health information that is protected by various data privacy laws like Health Insurance Portability and Accountability Act, commonly known as HIPAA, in the United States, or General Data Protection Regulations, commonly known as GDPR, in the European Union, or other similar laws in various countries across the world. Healthcare regulatory compliance is a difficult and complex space to manage for healthcare organizations and health IT companies. If not done properly, it can lead to significant direct cost impacts that may include costly fines that can be up to $50,000 per violation, legal damages and fees that need to be paid when impacted patients pursue legal remedies, and financial losses that may happen due to disruptions in business operations such events may cause. The consequences of noncompliance are not only limited to direct costs mentioned so far, but also there are many indirect damages that can have a significant impact on your business as a healthcare organization or a health IT company. Some of these impacts may be poor patient care and outcomes, erosion of trust with your customers and partners, all leading to a damaged brand that could result in severe losses or sometimes even business closure. So, in summary, non-compliance exposes your business to significant financial and business risks. Anyone in healthcare business knows that managing and maintaining compliance to HIPAA and other standards can be complex and time-consuming. It is also costly. It adds administrative burden on the organization and its employees by taking time and resources away from the core business and competencies of the organization. HIPAA compliance is generally seen as being one of the topmost difficult compliances to achieve. Many healthcare organizations and health IT companies are pouring substantial resources into their compliance and data security programs, trying to keep pace with complex and ever-changing regulatory landscape. As more healthcare organizations and health IT companies move and optimize on the cloud and enable data interoperability among payers and providers with their EMR and EHR systems and their connected medical devices, it could expose a compliance gap as regulations tighten, especially when handling the electronic protected health information. Securing patient data while enabling frictionless data interoperability and regulatory compliance can be challenging without the proper support and expertise. Healthcare organizations and health IT companies have an option to make a build versus buy decision for compliance management. If they choose to build internal solutions to help with compliance management, then they're investing resources, time, and money in tasks that may not be their core business activities, like taking care of patients or providing meaningful technology solutions to make healthcare more efficient. If they choose to buy, then they have options to leverage the expertise and solutions from third-party software companies whose core business is building solutions for compliance management. These third-party solutions can help with healthcare organizations and health IT companies offload their undifferentiated heavy lifting of building tools for compliance. That being said, The choice between build versus buy may come down to overall costs and current resources availability within an organization. In the next sections, I'd like to briefly talk about the AWS Marketplace and what we can do to help connect you with third-party solutions that address your compliance challenges. In this section, I'll provide an overview of the AWS Marketplace and highlight a few solutions that can help solve for your needs. AWS Marketplace is a digital catalog that can help organizations find, buy, and deploy various software solutions in the AWS cloud that address their operational needs while simplifying their software procurement process. We have solutions that solve for security and compliance challenges, as well as solutions and datasets that help modernize patient care, improve collaboration, and lower costs. We focus on our software selection, procurement speed, and deployment agility. With options like one-click deployment, digitized software purchases in AWS Marketplace allow you to quickly procure and use products from healthcare software sellers to address your needs. Software sellers in AWS Marketplace offer pricing options that give you the flexibility to test the software before you buy, pay as you go, negotiate custom discounts and terms, and save money with long-term commitments. You can also consolidate billing for all of your AWS Marketplace purchases and reduce procurement speeds, reduce procurement time by using vendors that have adopted standardized contracts. AWS Marketplace also empowers you to centralize governance of software procurement and management, innovate quickly and launch software products, help ensure alignment with your organization's policies and compliance requirements. Benefits include budget and cost control, the ability to curate custom catalogs in a private marketplace for your own organization, and procurement system integration for purchasing approvals and reviews. I'd like to share a few success stories from our AWS Marketplace sellers. As of today, AWS Marketplace offers over 150 healthcare and life sciences solutions from over 60 plus independent software vendors. We support various use cases, including our current topic of discussion today, healthcare compliance, as well as other medical imaging, healthcare data interoperability, and genomics use cases. Some of our healthcare sellers that focus on specifically on the compliance aspect are 8K Miles, CyberMDX, and Dash Solutions. 8K Miles. With the healthcare transformation moving at a rapid pace, regulatory compliance across the healthcare enterprise with disparate devices is a major healthcare IT challenge. 8K Miles provides a secure cloud-based solution that can help address compliance requirements. Their innovative framework provides the security and privacy controls you need to ensure your data is protected. With 8K Miles, you can meet compliance requirements for FISMA, PCI, HIPAA, and other standards for cloud and mobility solutions. Stay Smart Care is a leading remote patient monitoring service provider that enables aging adults to stay healthy and live independently in their home. 8K Miles helped Stay Smart Care address their compliance needs by providing them with a secure cloud-based framework to ingest the digital health data from the devices and sensors that monitor their patients at home. Their solution provides continuous, non-intrusive healthcare monitoring by using smart technology. Through remote monitoring services, the family members or healthcare professionals get to know their loved ones or the patients in their care proactively before the situations turn to be an emergency. 8K Miles helped build a scalable dashboard and data analytics platform that monitored thousands of patients while meeting HIPAA and GxP compliance requirements. Stay Smart Care also leveraged 8K Miles technical expertise and domain expertise to help HIPAA-compliant web and mobile application development. CyberMDX is another vendor that provides solutions for what is called as the Internet of Things, or more specifically, the Internet of Medical Things for security and asset management. This solution enables hospitals to identify, access, and defend against potential cyber attacks that may come through compromised networks, connected medical devices, etc. It provides continuous discovery of medical devices, a comprehensive risk assessment, and an AI-based containment and response mechanism. This ensures the operational continuity of organizations' critical assets and the security of patient and facility data. Assuta Medical Centers is the largest private hospital network in Israel, operating 8 hospitals and multiple medical centers. They treat 1 million patients yearly, and they are the second largest HMO in the country. Assuta accounts for about 15% of the surgeries in the country. CyberMDX helped Assuta Medical Center to identify, categorize, and secure all connected clinical and medical devices throughout their system. Assuta faced some challenges with conducting physical inventory of connected medical devices each year and maintaining compliance and security for these assets. Their existing security and network technology tools could not automatically distinguish between general IT endpoints and medical devices, causing additional compliance and security concerns. CyberMDX was chosen as the exclusive vendor for providing Assuta Medical Centers with a comprehensive platform to identify, categorize, and secure all connected clinical and medical devices. The agentless deployment was completed within a few hours, bringing visibility to the clinical network and shedding light on their clinical and medical devices. Immediate results were seen in 400 hours of labor saved in inventory asset mapping and 50% reduction of potential threats. The third AWS Marketplace solution I'd like to talk about is Dash solution. Dash offers a solution for configuring and managing HIPAA compliance across the customer's AWS environment. Healthcare organizations, health IT companies, and startups want to focus on innovative and product development rather than burdensome HIPAA regulation. Dash enables health IT organizations such as Redsson manage regulatory concerns while developing applications on a cloud platform. With the Dash Comply Ops solution, organizations can easily implement compliance policies, technical controls, and maintain regulatory compliance in the public cloud. Instead of me talking about how Dash helped Redsson, we have here with us today Chief Technology Officer of Redsson, Jacob Parcel, to give you an overview of the challenges they faced, the criteria they considered, the path they took to address the challenges, and the results they have seen so far. Over to you, Jacob.
Thanks, Ananth. I'm Jacob Parcel, CTO of Redsson. Today I'm going to talk to you about our journey deploying a healthcare app to AWS. Redsson develops solutions that help healthcare organizations streamline complicated manual processes and improve efficiencies. One of our products, Followup Pro, keeps patient information up to date in your cancer registry software to achieve accreditation and increase productivity. We search for the latest address and date last seen or deceased notification and deceased date. For Redsson, given the nature of the sensitive data that we handle, security and compliance is of paramount importance. Not only do we value security internally as one of our core values, but we also recognize the utmost importance that our healthcare customers place on compliance and security. Our applications were deployed across several platforms, a local data center, AWS, and a private HIPAA specialized cloud for healthcare. We hoped that the private HIPAA cloud would streamline our security questionnaires and make compliance easier. Unfortunately, being on the proprietary HIPAA platform did not resolve all of our issues with compliance and security questionnaires. We were struggling with security questionnaires due to not having enough internal formal policies or understanding how to handle the types of questions we received. We also found ourselves spending an excessive amount of time responding to and satisfying each prospective customer engagement's security requirements. Although we already had a strong focus on security, encryption, and keeping data safe, we hadn't made a big commitment to proof of compliance. We relied heavily on a private cloud provider for that. If we were going to take this on and be true to the shared responsibility model, we needed to make sure we were doing the right things. We had to uncover unknowns and evaluate for the right solution. Our evaluation process included, can we build it? Is it core to what we do? Has a vendor solved most of it already? And how long until we realize value and total cost? Security and privacy need to be core to our healthcare and non-healthcare services, but managing and improving compliance was not our expertise. If a vendor existed that solved that problem, we could likely start to get value right away and pay for part of the cost it would have taken us to develop the solution, since they could spread the costs to all their customers. Through our evaluation process, we discovered that Dash solutions could address our compliance needs. Why Dash? Dash offers a solution for configuring and managing HIPAA compliance across Amazon Web Services. Healthcare organizations and vendors like ourselves want to focus on innovation and product development and spend less time on managing HIPAA compliance concerns. Dash can enable organizations to manage regulatory concerns while developing applications on the market-leading cloud platform. We chose Dash for a number of reasons. They had a strong desire to reduce the time that we spent on security questionnaires, as well as a desire to consolidate our environment into Amazon Web Services and utilize services such as Amazon S3 and EC2 and autoscaling. In order to do so, we needed a solution which handled both the technical and administrative controls of HIPAA, as well as a partner with experience in assisting healthcare app deployments into AWS. Our journey with Dash first started with a consultative approach. They spent time with us understanding how we worked and how that fit into the policies and practices to deploy with AWS. The product wasn't full-featured at first, and we weren't able to take advantage of all it had to offer. So we decided not to renew our annual contract with them after a couple of years. But after some new conditions emerged, we needed to reevaluate this decision. We decided that Dash still had the feature set that was best for us going forward. They can help with our SOC 2 audit. Also, instead of needing to make a big annual contract decision, we were able to get started on the marketplace and get up and running very quickly again. Now, they have more self-serve features available. Let's talk about the overall business outcomes. Using Dash helped us save 4 to 6 weeks working on administrative policies, utilize the 100+ AWS web services available, which allowed us to pay for only what we were using, as well as the ability to use the tools we were already comfortable with. They gave us one view for compliance and empowered us to configure and maintain HIPAA compliance in one platform. 2 to 3 times more cost savings were realized. We saved almost 50% on our cloud infrastructure costs and hundreds of hours per year on engineering time, mostly in deployments. More deploys means quicker response to patching the system, making it even more secure and getting value into our healthcare customers sooner. Deploys are now more automated with a push-to-deploy pipeline. We also reduced costs by running only what we needed on AWS, as well as their competitive pricing for compute services. We were able to standardize deployments on all of our apps and services. Standardization let us invest more time into our infrastructure as code and made us better not only with the Followup Pro deploys, but across all of our applications. We also deployed security patches and new features quicker, easier, and more often, and had a better understanding of the whole system, which helps ensure compliance for us and our healthcare customers. We were able to achieve our goals and have confidence that our policies are well aligned with our practices. Vendor assessments became more straightforward as we own more of the shared responsibility model and have a clearer understanding of AWS's part. As you already know, managing compliance can be challenging. You still have to start with a secure architecture. And based on our learnings from our compliance journey, there are a few key points to consider when configuring and managing your AWS infrastructure that will ensure compliance for you, your healthcare organization, patients, and customers. Build versus buy. time to receive the value is important to us. If a solution exists and we can improve right away versus the time it would take to realize the value of building our own internal solution, it's a clear choice, especially if the customer solution isn't our core competency. Often the cost of using an existing solution will be less expensive as they spread the cost of development across many customers. Understand the shared responsibility model. What does AWS cover and what is left for you to do? Ensure data is encrypted at rest, including S3, RDS, block storage, etc. Audit and log all activity, including changes to your infrastructure, logins, usage reports, etc. Know which AWS resources are compliant. An example, certain EC2 instances weren't yet compliant when we were launching. Know how to configure AWS resources to be compliant. Just because a resource can be compliant, you still need to make sure it is configured properly. For example, S3 bucket permissions or an IAM role. Dash's scanning service helped us with most of these. By considering these items, it can make your journey easier by understanding what is working and not working, any needs or gaps you have. Using Marketplace to find our solution allowed us to get started very quickly from purchasing a service integrated into our AWS bill to deploying with a CloudFormation script right into our AWS environment. This also meant that the policies we have set for our AWS account would apply to the resources created by Dash's Marketplace solution as well. And with that, back to you, Anant.
Thank you, Jacob. That was a great overview of Redsson's compliance journey. I'm sure our audience benefited from hearing your experience. To wrap up, we have a few more slides to provide you additional information. You can discover the healthcare solutions for compliance that we discussed here by visiting the AWS Marketplace site at aws.amazon.com/marketplace/solutions/healthcare. While there, you can also browse for other solutions that may solve for other business challenges that you may be facing. We have also planned many other AWS Marketplace as well as healthcare sessions that you may find beneficial. Here are the AWS Marketplace and AWS Data Exchange sessions. My two personal favorites being MKT 205, navigating COVID-19 and optimizing wide delivery with data, and MKT 208, use data to win NFL daily fantasy sports. As you can see here, we have several other healthcare sessions being offered, topics such as Healthcare Executive Outlook, Fireworks for AWS, and using AI to automate clinical works, just to name a few. And all of our AWS Marketplace and AWS Data Exchange sessions would be available on demand, starting specific dates as shown in the schedule here. And with that, it concludes our session for today. Thank you for joining us at AWS reInvent 2020, and please be sure to complete the session survey. Thank you.